My first impressions of Dunedin were the nurses' home in Castle Street, where instead of being within a lovely family environment, we were suddenly, each of us, in a tiny room, but overlooking the tennis court. We convened at the school the following day, and there were about 6 of us who had been either to university or in the workplace for the past 12 months after leaving school. But the rest of the group were fresh from school. And there was initially a big difference in that those of us who had been out of the big wide world for 12 months had grown up. But that gap soon disappeared and we became a very close group. We had 2 from Africa who were very handsome young men, and they fitted in very easily too. We were dressed for our practical classes in white Airtex shirts and blue culottes. I don't know where mine are today, but they were very smart at the time. The classes were very dictatorial. I'm not saying that the teaching was, but it was just the way medicine and physiotherapy was taught in those days. It was diagnostically led. For example, we would have a class on asthma. We would learn about the pathology and then would be given a list of 1 to 10 as to how to treat the patient. The fact that the patient might be a child or an adult or might have severe asthma or very mild asthma didn't come into the picture at that stage. It was just 1 to 10, and that was how one managed the patient. And we just accepted this, even if we didn't fully understand it. But we did know that it would be important to regurgitate it for examination purposes. And this, most of us managed to do. At the end of our first year, we had one tester, I would describe it as, of a clinical placement. But it was not until our second year that we really started to appreciate what physiotherapy was all about, and its potential and its excitement. In our third year, most of us left Dunedin to go to one of the clinical schools in other parts of New Zealand, and at that stage it was Christchurch, Wellington, Auckland and Hamilton, because there weren't enough clinical placements for the first, second and third year students. Most of us returned to our hometowns where we could have free accommodation, and we spent the year there returning to Dunedin only for our final practical exams. Whichever placement one was in, one became enthusiastic about, but I think many of us were influenced by outstanding tutors in the different areas. And for me, that was cardiorespiratory work at Princess Margaret Hospital with Jill Cameron, who is now Jill Miller. And Jill was working very closely with Bunny and Heath Thompson. And under supervision, I had the opportunity to treat patients on Mr. Heath Thompson's ward. His ward at the time was a 6-bed intensive care unit with beds outside that for medical patients and surgical patients, the surgical patients being both cardiac and thoracic, because Mr. Thompson himself was an intensivist, a cardiac surgeon, a thoracic surgeon, and a chest physician. Today, these would be separate specialities, but he combined them all and had the most amazing ability diagnostically and clinically. It was a wonderful experience to work in that environment and really enthused those of us who were with him to appreciate what we could do for the patient and to perhaps follow that track at a later date. We knew, though, that the physiotherapy techniques being used on Heath Thompson's ward were not nationally or internationally recognised. And I'm talking about huffing and breathing control. And this was used for anyone with excess bronchial secretions, be it the pre-operative patient, the post-operative patient, the patient with asthma, with bronchiectasis, with chronic bronchitis, the person with a chest injury. And working with his team, it was so obvious that huffing combined with breathing control effectively loosened, mobilized, and allowed the patient to expectorate excess bronchial secretions. They didn't become wheezy, and there was no clinical evidence of any increase in airflow obstruction, which was the criticism from other parts of New Zealand and other parts of the world. So although having had a wonderful experience in this environment, we knew to not mention huffing if asked a question on the treatment of asthma in our final paper. And we didn't. I can't remember whether we did get a question on that topic or not, but we did manage to pass our exams.